What is a boxer's fracture? Remember, a fracture is another word for a broken bone. A boxer's fracture is when a person breaks a specific part of one of the hand bones. Now, the hand bones are also called the metacarpals, and the hand bone involved in a boxer's fracture is the bone between the little finger, the pinky, and the wrist. Even though this fracture is called a boxer's fracture, it does not usually happen in boxers. Instead, it usually happens when people punch a wall or other hard object. Symptoms of boxer's fracture include pain, swelling, bruising. The little finger or side of the hand may look like it's bent or in an abnormal position. Now, are there tests for a boxer's fracture? Yes. Your doctor will ask you about your symptoms and order an X-ray of your hand. Now, treatment depends on how severe the fracture is. If you have an open cut with your fracture, your doctor will wash the cut out. They will also give you a tetanus shot if it's been too many years since your last one. For the first few days after your injury, your doctor will probably recommend one or more of the following. Resting your hand. Keeping your hand above the level of your heart as much as possible. Putting ice on your hand. Taking pain medications. Now, you may take over-the-counter pain medications, including acetaminophen, also known as Tylenol, or ibuprofen, such as Advil, Motrin, or naproxen. Now, wearing a splint can also be helpful. This keeps your hand bones in one position so that the fracture can heal. Now, after the swelling goes down, some people may need surgery to the hand bones to stay in place and that they can heal properly. Whether you need surgery depends on the fracture. Now, you may also need to work with a physical therapist after your fracture heals. And the physical therapist will show you exercises and stretches to strengthen your hand and finger muscles and keep them from getting stiff. A boxer's fracture usually can take anywhere from 4 to 6 weeks to heal, depending on that type of fracture. Now, you should call your doctor if you have severe pain, or your pain or swelling gets worse, or you have numbness or tingling in your fingers, or your finger looks blue or purple.